Hello, and welcome to Lessons Beyond the Stethoscope, where we provide practical tips and tools that you can use in your everyday life. Because what we understand is that these things can your overall health. Today's episode is Should They Crack Your Back? Understanding Chiropractic Care. And today, joining us is Dr. Carlton Middleton, who is a licensed doctor of chiropractic, and he has over 25 years experience. He's a Savannah native, and he attended South Carolina State University and afterwards matriculated in Marietta, Georgia, where he earned the Doctor of Chiropractic degree. He currently practices at the Urban Family Chiropractic Life Center, which he co-owns with his partner, Dr. Connie Singleton. Outside of taking care of patients, he stays very busy with mentoring youth by coaching them and mentoring them. He also loves to play golf. And then he spends some time enjoying things with his family. So thank you so much for joining us today, Dr. Middleton.
Thank you for having me, Dr. Booth.
You're welcome. So, in recent news here in Georgia, that was a big story that came out, and it talked about how a patient experienced an adjustment and things went wrong. And apparently, that adjustment caused some issues. And because of that, there has been a lot of questions. There's been a lot of talk, a lot of people trying to figure out, okay, is it safe and things of that nature. And
Right.
they're concerned about the safety of chiropractic care. So with that, can you just explain to us just simply and just in the basics of just what is chiropractic care?
Okay. So, the simplest way I can put it is that as a chiropractor, my job is to detect, analyze, and correct what we call vertebral subluxations, simply mean misalignments of the spine. And after we analyze the misalignment of the spine, we correct that misalignment, and by correcting that misalignment, we allow the body's ability to function better and heal itself to occur at maximum potential.
Okay, so then misaligned and you guys want to get it back into alignment, because tell me what happens when the body is misaligned. What do people start to experience? What's going on in the body when it's misaligned?
Well, when you have those misalignments in the vertebral column, it usually involves a lot of tightness in the area, muscle spasms and swelling, uh, and the joints aren't moving like they should. And when that occurs, that nerve that's exiting the spine somehow it doesn't function at as close to 100% as possible, and wherever that nerve travels, it has those decreased functions. So by correcting the misalignment or correcting the vertebral subluxation, as we say, we try to restore that area of the body's ability to function better, move better, be more relaxed, and in the end, the nerve controls the body better.
I see. So it's kind of like one of the ways that I think about it is, like you said, if it's not straight and you like it's out of alignment, then it's going to start doing things that it typically doesn't do, and then the body starts to tell us, hey, something is wrong. And one of the ways it tells us is there's like some inflammation, there could be some discomfort. And I know a lot of you guys, it's probably like pain. Probably one of the main things that people come in and say, I'm having some pain here in this area. Is that essentially what happens?
Yeah, it's usually
Okay.
usually
Now,
people
when
come
you
to
guys
us
are
for a
doing
musculoskeletal
your,
condition.
okay, and when you're doing this, tell me, are there some risks associated with it?
Well, of course there are, but the risks are very minimal, and the benefits of chiropractic care far outweigh those risks, tremendously outweigh those risks.
And when people are coming in, what are the types of conditions are you treating?
And it's interesting you say that because it's important for people to understand that as a chiropractor, my job, as I mentioned, is to simply detect, analyze, and correct vertebral subluxations. As far as treating other symptoms, that's not our goal or our purpose. Now, people come to us because they're in pain, and let's say they're having low back pain. My goal is not to treat the lower back pain. My goal is to correct that misalignment, and by correcting that subluxation, the pain will go away. But if we don't correct that misalignment, no matter what you do, the pain keeps coming back.
That is a good way of looking at it and explaining it, because that also just helps to further drive home that point that things are not aligned. Then you can start to have issues with it. And in order for you to kind of those issues, then you put it back in alignment, and then you start to notice that you're going to start to get some relief. So that's a good way of looking at it and understanding it.
Yes, yes, I think so.
One of the things that I also people say, for lack of a better term, and kind of going along with the title of this presentation, is crackbacks. My thing was like, is that all that you guys do? And patients have even asked me, is that's all they do? They just crack backs. If do, what are some other like tools and things that you guys do to kind of get patients the relief that they need?
Okay. Well, and you're right. A lot of people have that misconception. Now, when you say cracking backs, we are referring to the chiropractic adjustment, but there are lots of different ways to adjust a segment. Some of them require very light touch. Some of them require a very heavy touch, but you don't have to hear bones cracking, as they say, or osseous adjustment to be adjusted. Our goal is to find out what a particular person needs. So after we go through an analysis, and after we do an exam and get a thorough case history, we may need to take x-rays. We may need to do some other diagnostic procedures like surface EMGs. Um, from there, we put the information together and we determine, well, what type of adjustment does this person need? Do they need a heavier force adjustment? Do they need a lighter force adjustment? So it's not always just coming in and turning on one side and cracking it back, and turning them on the other side and cracking their back, because you if you just do that without proper analysis, you can do more harm than good.
I see. And the interesting thing is we're using the term crack and crack and crack. The
Right.
the people, a lot of people say, well, when I hear that, it obviously must hurt, right? So what is your perspective on that?
It doesn't hurt me, it's my perspective, but uh a lot of people have, well, you have to understand that sound simply is a joint that has a capsule around it, and where air escapes from that capsule, you get a popping noise. It doesn't hurt. It's weird to a lot of people, especially the first time, but it's something easy to grow accustomed to. I mean, I just love it. I love getting those types of adjustments as opposed to lighter force adjustments.
Are you saying you like to do that personally for yourself, or those are the types that you like to do on your patients?
Oh, personally, for myself, that's what I like to do. But like I mentioned to you earlier, uh, our patients are analyzed on an individual basis, and we determine what is the best course of treatment for them, based on their needs and based on their medical history. So And plus, I have to be honest with you, the older I get and the more I practice, the less and less I'm able to deliver those types of heavy adjustments on a regular basis. So we have a variety of techniques, and we have a variety of equipment to deliver chiropractic adjustments, and we do those based on an individual's need. And with that, if someone comes into our office and they say, "Well, I really am scared of having my neck cracked or that osseous adjustment in the neck," if a person is not comfortable receiving that type of adjustment, we've learned, over years, we can find a better way to do it, so easier way to do it, so that they are comfortable in their treatment.
Okay, that's good to know. One of the things, since we're talking about this cracking and popping sound, I know myself and some other people growing up, you may have
Mhm.
heard people say, "Oh, stop popping your knuckles, stop popping your this, those certain joints and things of that
Right.
nature." Can you speak on what exactly happens during that? Because now you're telling me it's just like some air that escaping. But if someone continues to do that, one of the things that I was told was that my knuckles were big. Is that true, or what happens with that type of process?
No, your knuckles won't be big. No, you won't necessarily develop arthritis in them, but you have to. I would not suggest anyone cracking their knuckles, cracking their neck, cracking their back, or anything on their own, because sometimes you may go a little overboard. Sometimes you may do damage to the joint if you go too far into the joint while you're trying to make that cracking sound, as they say. So I would definitely suggest you not doing it for those types of safety reasons.
I appreciate you saying that because my next thing I was
Mhm.
going to ask you about are the TikToks. There
Okay.
are all kinds of TikToks that are out there and things that people are doing. There's one that I saw. There was a guy at the fair. Now, he did not look like a chiropractor. I'm not trying to stereotype, but he just didn't look like a chiropractor at that moment. And he just had a group of people
Right.
around and he was adjusting this lady or doing some things. And all you heard
Right.
was pop, 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 pop. And he was doing it over her entire body. But I
Right.
like the fact that you said that if it is not a licensed chiropractor, that we should not be attempting these things because we just don't know what can happen.
Absolutely, absolutely not. And I would hope that that person was a licensed chiropractor, because a bad adjustment can cause, it can cause you to have the opposite effect of what you're looking for. If you're looking for pain relief and you have manipulation that is based on guesswork and not diagnostics or not orthopedic testing, no type of history, then you can wind up getting the wrong type of adjustment, or in the wrong area, or in the wrong direction that it needs for alignment. And in turn, your symptoms can be worse.
Hmm. Okay, so good to know. Everybody, make sure
Yeah.
that if you decide that there's something that's going on, that you go and seek a professional for it. I want to pivot for a second because one of the things that I know is that you're very serious about what you do and you attend a lot of
Mhm.
educational seminars and you stay up to date on not only chiropractic techniques, but at these seminars, they talk about different things such as neurology and nutrition and rehabilitation, things of that nature. So I know that you have a lot of different things in your tool bag, and you told me that there are different things that you use to be able to get people the relief that they need, other than just adjustments. I know you guys use like some stem things like that. But what are some of the benefits? We talked about pain, but people come in for other reasons for chiropractic. What are some of the other benefits that you've noticed that people get from it?
Uh, I have professional athletes who have stated they notice the difference in their performance. They have increased performance when they are in adjustment. Even high school and some college athletes. We've had people who say, well, when they have their adjustments, they seem to be able to focus better, even when they're going through finals week and things like that. Um, some people who say that their energy levels have improved. But the important thing to note, as I mentioned earlier, is that we don't uh, treat these specific conditions. We are just analyzing, to detecting and correcting the vertebral subluxation. And I can give you a prime example of a woman who had migraine headaches for 15 years, 2, 3 migraine headaches a week. Uh, she came in and we noticed these misalignments at the top part of her spine. And after an adjustment, her migraines decreased from 2 or 3 times a week to once a week after the very first adjustment. You may say, well, she's still having migraines. But for a person who has
Hmm.
migraine headaches 2, 3 times a week, to go from that number to one, it was like a life changer for her. And then as we continued through the treatment of the subluxation, the migraines dissipated. And it was years before she had another one.
Oh, that's awesome. And I know that one of your things is that you say we want to get people whole and well without medications and things of that nature. So I know that's another layer on top of that, because with that patient, if they've had those for many years, they probably were taking medicines and trying to see if
Yeah.
that worked. Oh, it didn't work. Okay, what about this? And so that also makes an improvement from that aspect.
Yes, a lot of times we have seen patients who have gone through a lot, poke prodded, MRI, CAT scan, they've gone through a lot and they have not gotten the results that they're looking for. And some of them are frustrated, and some of them are just unhappy. But when we focus on finding the cause of the problem, if the cause of the problem is that vertebral subluxation and we remove that vertebral subluxation, the body has this amazing ability to heal itself. And if we can make sure the
Hmm.
body has no vertebral subluxations, has its proper nutrition, you're getting the exercise that you need, you're getting the sleep that you need, and a big thing is your mental health is strong, then your body that wants to be healthy will slowly and gradually become more and more healthier.
I'm glad that you brought that up, because that's one of the things that I see a lot when I started looking into chiropractic care. Because I'll be honest with you, I didn't know all of the things, right, of what you guys
Right.
did. But one of the things I see clear and consistently across the board is whole health. And whole health is, like you said, nutrition, it's exercise, it's
Right.
getting, movement and activity. So I'm glad that you brought that up as well, because that in itself also helps the body heal itself.
Absolutely. Absolutely. You can't be one dimensional. There is no magic bullet for you. You have to find out what it takes for you to maintain optimum health. And I'm big on prevention. And I tell people all the time, hey, look, I have a medical doctor, I have a dentist, I have an optometrist, I have a naturopath, I have a massage therapist. I mean, whatever it takes, you have to be willing to do what you need to do, regardless of what your insurance says. You need to do it for yourself because you have to take your health and keep your
Mhm.
health in your own hands.
Absolutely. I love that. If someone starts chiropractic care, do they have to continue it? Is this a lifelong thing, or you lessen my issues, you have aligned me, I am now in a line and with and one with myself. Am I done?
Okay, that's a good question. And in our office, we don't force people to come into our office, but we will give you the options. So we have like 3 levels of care. If you want to come in and just get out of pain, that's your goal. You want to get out of pain. Well, we may be able to see you 10 or 12 times, and that lower back pain or that neck pain will go away. But if we want to prevent it from coming back faster, we may have to go a little longer. And then after that, well, we may need to maintain it so that it does not ever come back. So, long story short, we have patients that have gone through the relief phase of care and they're into their wellness care. Some of them, because of the age, we see them once a week. Some patients, we see them once a month. Some patients we see 2 or 3 times a year. Do you have to keep going? No, but if you found something that would benefit you and that keeps you healthier and keeps you mobile and functional, then to me it's a no-brainer. You shouldn't stop. I myself, I have to be adjusted. I can't go 2 weeks without it. I wish I could get it every week. Not all the time. I wish I can get adjusted every week, but I can't go 2 weeks.
And don't go, if you go longer than the 2 weeks, what happens? What do you notice?
First thing I notice is sleeping at night. I start getting tension in my shoulders. I notice more stiffness in my joints when I get out of the bed and I want to get up in the morning and I go through my little stretching routine. I just feel tighter. And I consider myself to have a moderately active lifestyle as far as running and walking. But don't have uh, I don't have the performance issues when I'm in adjustment and in alignment like I need to be.
Okay. And it's I like that you mentioned that, because then that also goes along with some of the other things that we have talked about and how you guys look at the whole health. And we'll get into it in a second, but it's a part of the treatment plan, because once you go that one time for adjustment, it's almost like you have homework at the end of the visit.
Yeah.
And you guys are like, okay, I need you to work on this.
Yeah,
And until we get back. And it's simple things like just stretching. People underestimate the power of stretching. And so we're
absolutely.
going to talk about that for a second. But before we get into it, I just want to talk about how you guys practice at Urban Family Life Chiropractic Center. You guys get rave reviews from your patients. They love you. It's like a family atmosphere. And so tell me, if someone comes into the door and they say, I am experiencing whatever symptom, how do you guys approach that patient and walk them through to the point of which treatment plan is the right treatment plan for them?
Um, well, we start with a simple case history and evaluation. And after that case history and evaluation, we will do an examination on the area. Um, if needed, we'll do surface EMG, which measures nerve activities, nerve impulses coming off of the spine to see where there are areas of increased activity or decreased activity, and then determine what type of x-rays or how many x-rays they'll need. That's the first visit usually, and we won't adjust them usually on that first visit because we need to analyze the information. We need to put all that together and paint a picture of what this person needs based on the limits that we see before us. So when we invite them back, it's usually going over those x-rays, going over those results, and doing a test type of adjustment to see how they respond. And if they respond a certain way, a way that we expect them to, then from there we can go back and come up with a care plan, a plan of action for them, basically explaining, hey, this is how many visits we think you need, this is how long it's going to take, this is what it's going to take, this is what the costs are, these are our options for you. You decide and you let us know, and we're going to try to give you the best care possible. And that goes as far as even trying to determine, which of the doctors is the best fit for that patient as well.
Oh, I see. Okay, so and then with each patient, it's like, yes, there's a standard of care that you keep in alignment, because you say, okay, these are the things that we need to do, but you also adjust it and tailor it to make it sure that it makes sense for your patient.
Oh yeah, absolutely. And in that though, like I said earlier, it's not a pressure sale. I'm not trying to. I want you to do this for yourself, and I want you to be a part of the process. Just like you mentioned before, you have some homework to do. A lot of people are used to just placing their care into the hands of the healthcare provider and thinking that they're going to do all of the work, but that's not true. So if you're willing to do all of the work, make the commitment in the time, make the commitment financially, make the commitment and play 100% full on, you're going to get our best, and we're going to try our best to get you as close to 100% as possible.
Well, awesome. Thank you so much. Are there any other comments or some tips or anything that we didn't touch on that you would like to add?
Um, well, I would like to commend you, Dr. Booth, because I have seen you in action, and just like uh, we are trying to help people to reach higher standards of health. Um, that particular art has become is becoming more and more of a lost art across the board. And we don't see our patients as numbers, we see them as individuals. And I know you are the same way, and I've seen you interact with your patients and getting to the root cause of what's going on with them, and then teaching them and showing them what they need to do and holding them accountable for it. So I just commend you in your efforts, and I wish you the best. And thank you for
Oh,
having
well,
me.
thank
I
you
really enjoyed
so
it.
much.
Yeah.
Yeah, absolutely. I really appreciate you taking the time out to discuss this with me and with everyone else that's watching, because I know that they've learned a lot. I know that I've learned a lot because, like I said, my information, I knew what you guys did. What you do now is
Right.
totally different. Understand that it is
Right.
a holistic approach to health. It's not only just the alignment, but if you think about it, like we're talking about alignment, like with the bones and the body and the joints and things like that. But it's really is being in alignment with all the things in your life, your diet and
Yes.
exercise and stretching
Yes.
and all these different things. So thank you so much for just taking the time to teach us so many of these things and giving us an idea, a better understanding of chiropractic care. I really appreciate that.
Thank you
Guys,
for
if
having
you
me.
have learned something, oh no, absolutely. If you guys have learned anything, if you enjoyed this, I want to make sure that you continue to share, to like, to subscribe, to let people know so they'll understand. So that way we can continue to put information out there that makes sense for you. So that way you can learn more and overall just improve your overall health. Thank you so much, and I will see you soon. Take care.